Just say asking about this stuff.
What time are we starting?
Right now, sir. We are just live. We are about to start. Good afternoon, everyone. This is Batul from ITCP, and I would like to welcome all the viewers who have joined our platform for the better exchange of knowledge that is going to be shared through this platform. So today, the topic for the session is weight gain and breast cancer awareness program. I would like to welcome all the panelists who have joined our platform, along with the moderator who is here with us today, Dr. Bhushan S. Bhalgat, sir.
Hi.
Dr. Bhushan, sir, is Dr. Bhushan sir is the moderator for the session for today. He is the consultant oncosurgeon, MBBS, MS, MHC, FMS, MRCS, TUGSS, India Coordinator, IASO Society member. Dr. Bhagat sir is currently associated with Shahidri Hospital, Pune. His illustrious career spans over 7 years, during which he has performed numerous critical surgeries on patients. His contribution in Pink Hope initiative is remarkable as it marks significant step towards strengthening the fight against breast cancer in Pune. The initiative emphasis on education, awareness, and support will undoubtedly benefit from the expertise and dedication of him. He has authored numerous international and national papers that delve into various aspects of cancer research. Before moving on to today's session, let us have a brief look on what the topic is about. Weight gain is a significant factor of influencing the risk of developing breast cancer in women. Research has shown a clear association between increased body weight and an elevated likelihood of breast cancer occurrence. We'll be learning more about this with the link to prevent breast cancer and improve overall well-being with the panelists who are present here with us today. So now I would like to welcome all the panelists at our forum and would like to hand over the session to Dr. Bhalgat sir to continue from here. Sir, over to you.
Thank you so much. Before proceeding, I would like to introduce all the panelists on the forum. So first of all, Dr. Harit Chaturvedi sir. He is a MBBS, MS and MCH. He is a chairperson at Max Institute of Cancer Care. He has joined Max Healthcare in 2009 and passionately built one of the largest and finest oncology platforms in the country with over 30 years of experience. With an experience of over 30 years, he has a publications and scientific presentation in over 50 national and international conferences. He has been supporting the cause for cancer awareness and has been a crusader against tobacco for last 15 years through various cancer foundations. He is an active member of ISO, Oncology Forum, Indian Society of Oncology, Core Cancer Foundation, ASI, Association of Breast Surgeons of India, and Delhi Medical Association. I welcome you to this forum of IGCP. I would also like to introduce our second panelist, Dr. Chinta Madaka Sairam sir. He is a MBBS, he is a DMRT, MDRT, FIMS. He is a director and senior consultant oncologist at Swarna Sai Hospital, Hyderabad. He is currently associated with MNJ Institute of Oncology, Regional Cancer Center in Radiation Oncology, Medical Oncology, Preventive Oncology, and is a principal investigator in various clinical trials, apart from being in charge RMO for a short time. He has more than 3 decades of experience. He has received numerous honors, including Padma Vibhushan Mehdi Nawaz Memorial Award, Director General's Commemoration Medal, Rhodes Scholar Award, Rashtriya Ratan Award, Academy of Medical Specialists National Award, and many more. He has been also awarded the GSA's Outstanding Citizen Award by the President of India. He is a member of American Society of Clinical Oncology, European Society of Medical Oncology, International Society of Pediatric Oncology, Indian Society of Oncology, and many other prestigious societies. I welcome you, sir, on this forum.
Thank you.
I
Thank
would
you.
also take the pleasure to invite our third panelist, Dr. Bandana Sodi, madam. She is a MBBS MD Gynec, DNB Obstetric Gynecology, and an infertility specialist, and is currently associated with Fortis La Femme, Greater Kailash, Delhi, and Rosewalk Hospital. She has an illustrious experience of more than 26 years and has worked at one of the best medical institutes of India, like an Army Hospital, Delhi, and has served patients coming from every strata of society. She holds her expertise in treating and managing conditions requiring laparoscopy, hysteroscopy, and gynec facilities ranging from antenatal checkup, painless delivery, care of pregnancies, and deliveries including high-risk pregnancies. She has received many awards and accolades for her significant contribution to medical literature. To her credit, there are many scholarly articles published as various internationally acclaimed medical journals, and she has also been invited as faculty in several national and international conferences. She is an active member of many esteemed medical organizations. I welcome you, madam, on this forum.
Thank you.
So, as we proceed with this session on breast cancer risk with weight gain, I would like to first ask Dr. Harit sir, what is the current status of breast cancer in India?
So thank you, Dr. Bhalgat, for having me here. And I want to say that this is a very important topic. Breast cancer is on the rise, and we all can combat this disease just by awareness, improving awareness. And therefore, all these opportunities should be multiplied as much as we can. So we know that breast cancer is growing up, increasing. The incidence is on the rise, and it's increasing by about 1.8% per year. So today, almost 2 lakh women are diagnosed with breast cancer every year in India. So of the 14 lakh people who will be diagnosed with cancer in a year, almost 2 lakh will be only breast cancer. That we can understand the importance of this particular disease. And it is due to various factors. It is playing a very significant role. And the good part is that a good chunk of this is either preventable or can be screen detected or early detected. So high cure rates can be achieved very successfully in the management of breast cancer. And it is affecting all strata of society. It is actually almost like I would say, pandemic proportions, that we need to improve the awareness very rapidly on different aspects. Yeah.
Thank you so much for your answer, sir. Now I would like to address Sodi, madam. Can you list the causes of breast cancer in general for our audience, and also elaborate if any specific causes, age-related causes are there?
As has already been elaborated, that it is one of the commonest cancers today, and it is one of the commonest cause of death in women, and it's the second most common cancer in women. And the factors which can lead to it is exposure to estrogens. So the factors which increase the number of your menstrual cycles and expose you to more estrogen, these factors would include an early menarche and a late menopause. So this exposes you to more number of cycles. Secondly, other factors would be nulliparity, and if the first pregnancy is beyond the age of 30 years, then no breastfeeding, and family history, with history of first degree relatives having breast cancer is a very important history here. So the chances are that has a 1.8% fold increase if the first is affected, and if two are affected, then 2.93 times it affects the individual. So all these factors which expose you to a longer duration of estrogen will predispose you to the risk factor to develop a breast cancer, along with genetic factors which are there, like the BRCA1, BRCA2 genes, which are, if they are there, then definitely the exposure to them or the passage of these genes will predispose you again to develop breast cancer. These are the common things which are there. There are many other reasons, like lifestyle changes and inactivity and intake of alcohol, and these things also enhance the chances of developing breast cancer.
Thank you, ma'am, for your answer. So to summarize, basically either genetic factors or the second factors, which is most important. Actually, the most important one is estrogen, hyperestrogen. Cumulative estrogen level in the body is a main causative factor for breast cancer. So, Chinta Madaka sir, I would like to ask you, can you list some common cancers related to weight gain?
There have been many studies to find out which cancers are affected. Out of them, breast cancer stands to be having almost 35% higher relative risk of developing breast cancer than endometrial cancer, 7.5 relative risk of getting cancer when compared to other population, general population. And esophageal cancer, which we never thought would be having 4.8% relative risk, is there. And rest of the cancers like 0.3 and thyroid, multiple myeloma 1.5 time relative risk, gastric cancer 1.8, liver and colon cancers 1.3 and 1.8. So these are 13. Meningiomas are also there, 1.3, ovary 1.1% relative risk, renal cell carcinoma 1.8 relative risk. So about 13 cancers have been found to have a data which shows that they have a higher preponderance with weight gain or obesity.
Thank you, sir. So basically, we should know that obesity is not only a cause of cardiovascular ailments. A lot of cancers, including breast cancer and endometrial cancer, especially, are affected by obesity. Again, coming to estrogen, which will be discussed in future in this session again, how it is related. So coming back to Harit sir, sir, what is the link between obesity and breast cancer?
So again, what happens? Obesity is also leads to hyperestrogenemia, and it also leads to insulin resistance. So both these things and increased adiposity, all these factors come into play, and that has a higher incidence of leads to breast cancer. So if you can keep a low BMI, then you can control the incidence of breast cancer, and therefore physical activity, diet management, all these things come into play. And so the main, I would say, the attribute, the reason is to estrogen plus the insulin resistance and increased adiposity. All these factors come into.
So, sir, how does estrogen increase in an obese person? What is the mechanism for our audience to know?
It is both. One is at the ovaries, the ovary gets in there, and the other thing is the adipose tissue. That is where the estrogen breakdown happens, and that increases the circulation of the estrogen in the body, in the blood.
Yes, sir. So basically, estrogen is prepared in the ovaries, but the adipose tissue is the one which makes it active, in simple terms. So
Yeah.
the more amount of adipose tissue we have, the more amount of estrogen we will have. Right, sir?
Absolutely. Absolutely.
So now coming to Sodhi, ma'am, what does estrogen hormone also have an effect on other gynec cancers apart from breast cancer?
Yes, yes. Exposure to the estrogens will increase endometrial hyperplasia. So if the endometrial hyperplasia is atypical or complex with atypia, it can predispose you to endometrial cancers. And some ovarian cancers are also known to be associated, like granuloma cell tumors of the ovary are also known to be associated with increased exposure to estrogens. So endometrial cancers, ovarian cancers, and breast cancer. 3 things which can happen because of exposure to estrogens.
Oh. Chintamanaka sir, does getting involved, so now we are talking about weight gain and breast cancer. So getting involved in a weight loss program after a breast cancer diagnosis, will it help reduce the recurrence risk? It's a very specific question, sir.
Yeah, diet and exercises are supposed to reduce the cancer risk by 66%. Bariatric surgery seems to, on an average, reduce by 38%. Just physical activity alone can reduce the breast cancer incidence by 8% and prostate cancer by 6%. So most of the cancers seems to be having decrease if they have diet, exercise, or any other physical activity. If they are involved with it, seems to have beneficial. Just 1 minute of physical activity is supposed to reduce almost 7% of having malignant risk. That's what they So physical activity, what patients they have to physical activity, whatever they have been doing before, should be our preaching. What normally is that once they are diagnosed with cancer, that we tell them. I mean, most of the people seem to have bed rest and other things. So that should not be the thing. Let them continue with their regular activities as far as possible, and if possible, try to increase the physical activity and diet control. This is the what the literature says.
So not only before getting a breast cancer, the obesity, if reducing obesity is going to reduce the risk, also after getting a diagnosis of breast cancer, if the patient is active physically and tries to reduce weight, he or she can definitely reduce the risk of recurrence.
Yeah.
So
Almost
coming to yes.
almost just physical activity alone reduces in breast cancer by 8%, and diet and exercise put together can reduce almost to the tune of 66%.
So Harit sir, coming to the surgical part, does losing weight decrease the risk of breast cancer, especially by bariatric surgeries, not only physical activity?
Definitely. So finally, whichever way you reduce the weight, that's going to help. And bariatric surgery is one straightforward, something which makes an immediate effect. So everything else takes time, but people where there's a high BMI, about 35, I think, in those cases, one should consider bariatric surgery as well, not just for the cancer and prevention of recurrence, but also for overall health, including the cardiovascular and other events. So overall, this is a good way of controlling weight and low BMI, BMI.
So basically, the patients who fit in the criteria of bariatric surgery, they should undergo, because there are two ways of benefits. One is by reducing the amount of adipose tissue, which will reduce the estrogen level. And also bariatric surgery helps decrease insulin resistance by metabolically acting. So both ways it is going to reduce the risk of breast cancer. So Sodhi madam, does the menopausal status make a difference in the risk related to obesity? So is a premenopausal woman different from a postmenopausal woman related to breast?
Yes, there has been a change there's an inverse relation, it has been seen. In postmenopausal women, when the endogenous hormone production of estrogens is stopped. But with weight gain, what happens is that the adipose is functional. Am I audible? Yes. So the adipose tissue is the place where the androgens also converted into estrogens. So if a postmenopausal lady gains weight, then the chances of estrogen exposure are again high. And that will again predispose her to a higher risk of breast cancer. Whereas in the perimenopausal or premenopausal, it is the insulin resistance which works more and not the adipose tissue, because the endogenous estrogens are present in that case. So if a postmenopausal gains weight, she's definitely more at risk of developing a breast cancer, right? Because of the conversion in the adipose tissues. So again, the same factor, activity, maintaining the correct BMI, and decreasing your risk of being exposed to estrogens in the body. So one shouldn't think that if menopause has set in, then chances of exposure are less. So it is the weight which plays a very important role here, right?
Right. So estrogen being the main cause, like madam said, let me summarize. If a female is a premenopausal female, ovaries are active, estrogen is there. That is not the main cause of breast cancer in premenopause. It is the insulin resistance in a obese premenopausal female which acts. In a postmenopausal female, it is the adipose tissue which is more important. So the rate of having a risk in the postmenopausal phase is more for breast cancer compared to a premenopausal female. Right, ma'am?
Correct.
Yes.
I think we have lost Sriram sir. So I would like to come back to Harit sir. Sir, what is a mammography breast density? Does it differ with age, and is it related directly or paradoxically to breast cancer risk? So would you like me to repeat, sir?
Yeah. So basically, mammography is the most commonly used or one investigation which has helped in screening of healthy women for breast cancer. So it becomes very important for us to understand the mammography, and also important that digital mammography or the equipment should be right so that you're able to actually get a proper mammogram done, because mammogram not done well may give a false sense of security or may unnecessarily lead to investigations that are not required. So it is important that we have proper mammograms. Now, what happens? The density of the breast is linked with the glandular tissue and the fibrous tissue plus the fat. It is a fat which causes the translucency, and the glandular tissue and the fibrous tissue cause the opacity, you can say. And that part is the density of the breast is reflected by the glandular and the fibrous tissue. What is important, if the breast is too dense, then it becomes very difficult to pick up breast cancer easily, because the screening becomes a bit difficult, and therefore you need additional imaging and proper interpretation. That is critical. Having said that, with increased density, there's higher propensity of mild increase in the incidence of breast cancer. So if you have dense breast, then you need better screening and more close evaluation as well. So that is important. And with aging, this density goes down because the glandular tissue gets gradually replaced by the fat tissue or adipose tissue. And that also leads to, so overall, I would say that density is important for risk assessment. It's also important to make sure that we are able to make sure that we are assessing the breast properly. So if there's too much of density, then we should do additional investigations, maybe an ultrasound. If required, even an MRI is required, that should be done. But make sure that we have a proper assessment done. That is important.
Right. So basically the density decreases with age because the fat tissue increases, but the risk also increases in a dense breast. So we have to be very sure while we do the which test for a breast lump in a obese patient should be chosen wisely by the physician. So Sodhi ma'am, are there any numbers which you can quote whether how much weight is going to affect the breast cancer risk?
Weight
so
gain, BMI of more
at
than,
BMI, how much BMI will affect?
see, BMI of more than 35 categorizes you into an obese status. Up to 30 or overweight, and a BMI of 35 is obese. So definitely anything starting from overweight till you reach obesity, which will expose you to high risk. Right? So one should be less than, you should be at the ideal BMI. 30 is overweight, 35 being obese.
Right. So the exact criteria ma'am has quoted is 30 is the overweight, 35 is obese, 40 is morbidly obese. So every 5-point increase in BMI is going to increase the risk of breast cancer by 1.8 times. So that is the risk of breast cancer in an obese person.
Yes.
Sairam sir, I think you have joined back. Can you hear me?
Yeah.
So sir, I would like to ask you, does the location of excess fat, like whether is it a central fat or a peripheral fat, does it matter when it comes to a breast cancer risk?
Like for any other disease, so central fat is supposed to be the central obesity, what we call, is the risk factor for cardiovascular disease, hypertension, diabetes. So also malignancy. Like muscle mass is having more muscle mass is protective. Having more fat is a causative, is supposed to be more harmful.
Yes. So central fat basically is more harmful than the peripheral fat, like in other elements. Similarly, breast cancer risk also increases.
Yeah.
Also, I would like to also address you only, sir, Sairam sir. What are the overall benefits of maintaining healthy weight apart from cancer?
Like 1/5 of adult population all over the world are obese, and almost 640 million are obese. So this obesity is the main cause for not only malignancies, it is the main cause for diabetes. It is indirectly causing malignancies also. Diabetes itself is a factor for malignancies. Hypertension, cardiovascular disease. Hypertension itself is a risk factor for cancer. So this hypertension, cardiovascular disease, and cerebrovascular accidents, all these things are supposed to be obesity-related ill effects. So not only that, we will be addressing the second commonest cause of cancer, deaths in the world, that is cancers. The first commonest cause of cardiovascular disease also we'll be able to address if we can have and the almost we are spending as per 2020 US data, $28 billion. And in 2030, we'll be spending almost $66 billion US dollars for managing these obesity problems, including malignancies, high cardiovascular disease, and all other areas whichever are I have mentioned.
Thank you, sir. So I would like to address Harit sir, the last question of the session. Sir, any advice for the audience who are listening to us to reduce the breast cancer risk in general?
So as we all discussed this far, that there are few important factors which are leading to etiology, increased incidence of breast cancer. And fortunately, quite a number of this can be addressed. It's a lifestyle thing. We can all develop the best habits and control our body weight, eat the right thing, keep physical activity good, and avoid tobacco and alcohol. So if we manage these things, the incidence will go down significantly. The other thing which I want to emphasize that otherwise also the breast cancer can be detected very early. There's no need to ignore any symptom in breast cancer. Whether you feel a lump or whether you have a nipple discharge or any problem, consult your physician or surgeon or gynecologist, consult somebody and get a test done. Today, ultrasound is available far and wide. That's a very basic evaluation. You can get it done anywhere. Consult an oncologist as far as you can, or if it's not possible, just approach a general surgeon or a gynecologist, and they will set you for the proper first round of investigations. Even if you don't have any symptoms, if you have a family history, then also get yourself checked up. And if nothing is there, a healthy woman also above the age of 40 years should get annual, at least biannual checkup till the age of 50 years, and after 50, at least annual checkup should be done. Because if you pick it up early in stage 1 breast cancer, it may be 95 to 100% cure rates. So we should not lose that opportunity. Ignoring a symptom for 2 to 3 months may lead to significant impact in outcomes, and delay in diagnosis can have, and you need multiple treatments and things like that. So my suggestion is that use these tools, this information wisely, and we all can have a better healthy life. Thank you.
Thank you, sir. So basically, we have to be alert for any breast cancer symptoms like lumps or nipple discharge or any lump in the axilla, nipple retraction. Annual mammography should be done by as per the guidelines, whatever 40-45 age group is there. And sir, there is one more question from the audience. Sir, does weight loss decrease the risk of breast cancer related arm lymphedema?
So it will have an impact on lymphedema as well. So lymphedema gets worsened by infections in the arm. So any stimulus which is causing lymphangitis. So once the person has had a surgery where the axilla has been addressed fully, and especially if the person has had radiation also, the probability of lymphedema goes up significantly. So in today's era, if there's no negative disease, we do sentinel node biopsy to avoid any lymphedema. Having said that, obviously there will be people who will require it and who have to undergo both surgery and radiation. So incidence is there. And this gets worsened both by infections, by lifting weights or causing some such injury which can have lead to lymphangitis. With weight loss, this can go down. This will become easier to manage. And obviously, if you are regular on exercise, even lymphedema will be less.
Right. Sudhi ma'am, there is one question from audience. Like patients are on endocrine treatment for early stage breast cancer, like tamoxifen is going on.
Yes.
So during that time, does weight gain have a effect on a better effect during that treatment also?
See, as has been already said, weight gain does not help in any way, right? It is an ideal body weight and physical activity which helps. Yes, with tamoxifen, you definitely need to monitor the uterine lining because that causes increase in the uterine lining. And we need to see whether it's an effect of the estrogens because of excess weight or because of the tamoxifen itself. And hysteroscopy and a biopsy is mandated if the lining increases when a patient is on tamoxifen. So weight definitely will play a role, where it has been said till now that weight gain is a pandemic now. So we need to definitely control that to have less side effects of any medications also which the patient is taking, right? So monitoring of the uterine lining is very important when a patient is on tamoxifen.
Sairam sir, one more question from the audience. is there an impact of the side effects of the medication when patients on maintenance therapy? Does the side effects impact the adherence and persistence to the hormonal therapy?
Yeah,
It's not
we-
related
when
to
we-
weight gain.
when patient is on chemotherapy, we normally give steroids. So steroids itself can cause a lot of weight gain, and it can also increase the sugar levels rapid. Uh, Hypertension also can increase. So steroids as low as possible, preferably if it can be given orally, be better, because body will absorb whatever is required. And otherwise, IV also, what to the extent it is required, you have to give. And probably in the first cycle, you may have to give full dose. Maybe in the later cycles, you can come down with a steroid dose. This all comes with the experience. And when we are giving chemotherapy, we have to probably give more anti-diabetic treatment and antihypertensive treatment more vigorously. But when the patient is discharged, probably we have to go back to their original doses, because when we are giving chemotherapy, we will be giving steroids, fluids. So they intend their sugars and hypertension will be increased. So during chemotherapy, you have to be a little bit more aggressive in controlling their diabetes and hypertension. But once they are discharged, you have to taper it back to their original level. It is a very challenging method of treating. So also not only for chemotherapy and other things, so for even surgery also, if you see 30 days post-operative mortality is very high, because patient is immobilized. Malignancies can cause lot of thromboembolism. So we have to keep thrombolytic therapies also. Even while on chemotherapy also, we are supposed to give low molecular heparin, like one of the trials I was the investigator, and it got published in ASCO also. Probably in future guidelines, all these things will come out. Did it answer your question, the query?
Yes, sir.
I just want to add one thing, that surgery is quite safe for breast, and today even for other oncological surgeries, it has become quite safe with best practices. And as Dr. Sairam said, LMWH usage is much higher. In fact, it is our routine practice for all advanced malignancies, in fact, pelvic malignancies, any surgery going beyond 2 hours. All these things have to be kept into mind, and prophylactic low molecular heparin given is helpful in saving a lot of lives. So overall, with today's best practices, it is possible to have a safe surgery in almost all parts of the body by a well-oiled team. So it's very safe.
Thank you so much, sirs and madam. To summarize, I would like to say that breast cancer is on a rise. It is one of the most common female cancers, not only in the world, but also in India. Weight gain is a risk factor owing to estrogen and insulin resistance. Menopausal status does not matter especially pre-menopause. Post-menopause, we have to be very aware. Also, there are other cancers estrogen is going to hamper, like endometrial cancer is one of them. Obesity is going to hamper that endometrial cancer also. Excess fat should be controlled by physical activity or by doing bariatric surgery. And maintaining a healthy weight is not only going to prevent us from breast, but also other cancers. So doing an annual mammography, being aware of the symptoms, and consulting an oncologist or oncophysician immediately on the symptom arrival is important. So this was all about today's session on breast cancer and weight.
Thank you.
Thank you so
Thank
much
you.
to all the panelists. Thank
Thank
you
you.
for your valuable time and for the inputs that you have put on upon such an important topic that we have shared today. So we hope that the audience have got the information that they were supposed to receive from this particular insightful session that we have conducted today. So thank you to all of you for your valuable time and for being here at our platform and for your presence as well. Thank you so much.
Thank you.
With
Thank
this, we are concluding the session here for today. Thank you.
Thank you. Thank you.